Hello and good morning. My name is Sue Morris. I'm a clinical nurse educator at the New Brunswick Heart Center, and I wanted to speak to you today a little bit about the bracelets that we use post-radial cath. And so before I start, I just want to say a big shout out and a kudos to all of my Ambulance New Brunswick colleagues. Thank you very much for all of the work that you do, because you make the New Brunswick Heart Center a success. So we greatly appreciate all that you do. Okay, so let's start. Let's start with my first boy, and I always have boys because I like hanging out with boys. So this gentleman has a left catheterization, which is not as common as right. And so the reason why they choose right is just the anatomical ease that allows the interventional cardiologist to access the heart. But this gentleman, for whatever reason, had his left radial artery accessed. So he has one of our more economical bracelets. And so what you will see is either a white or a black piece of sponge and then a gauze underneath where the insertion site is. This is all it's doing is applying direct pressure. And when we release it, we usually will put a mark with a marker right here. And then we release it 1 to 2 clicks. And that's a rather subjective thing. So we pull back, and you just use your thumb to apply a little pressure, and you get a release, and you mark that site again. So the expectation that we would have of Ambulance New Brunswick is to monitor, watch the patient's hand for the 5 P's of limb ischemia. So pain that's at a proportion to what's happening with the patient. Pallor, so I always say blue is cool, but white's not right. And I'm preaching to the choir here, you people know this already, but pain, pallor, pulse, paralysis, and paresthesia. So those are the 5 P's to assess limb ischemia. And so many of our patients will complain of a bit of a paresthesia or tingling in their fingers, namely the two, your ring finger and baby finger. That's pretty normal, but really what we're looking for is pain that's out of proportion to what's happening or a significant difference in color. So our expectation would be for you to assess that. You don't have to manipulate the bracelet at all. If it were to come inadvertently loose, then it's just like any other arterial puncture. You could tighten it back up, or you could apply direct pressure. And so to tighten, you just push down in the center and pull up on the longest tail, and that will tighten it. So this is a very simplistic compression device. Then we have 2 others. So this patient, his hand is the right hand, and so this would be a traditional access to the cardiac vessel. So this one right here that doesn't project very well, but this one here has a large compression area. But if you look at it, there is a little circle in the middle of this, and I don't know how well it projects. Yes, okay, so you can see the little circle. That's where the main area of compression comes in. And so the nurse may have this tail tucked in. It just sits in, or it could be like this, just free. So this one has a little tail, smaller tail, that fits in beside the large tail and creates a lock, so that if the smaller little area here were pushed, the bracelet would not release. So in order to release this one, you would take it out of its little position here, take it out. Then you would flip up this little device right here, and it is attached. Again, you would mark the area if you were the releasing person, and pull out on the tail so that you get a release of 1 to 2 clicks. Again, mark your spot. Again, our expectation of you would be to assess limb integrity and to just make sure that an adequate pressure was on this, that no hematoma was forming. And I often palpate into the side, and I do like this particular bracelet for that reason. This is another bracelet that we have started using. This is the one that patients like the most. It's very comfortable, and it comes with a syringe. And so when the nurse gives you a report on your patient, there should be a syringe, and it's a very unique syringe. It's a volume limiting syringe. If you can see, it's got a little bit of a white circle on it, and that allows for a release of 2 mils of air at one time. So if I apply this syringe, just screws in, you can see that 2 mils of air came out very quickly, but this white button has prevented any more from coming out. Again, the expectation would be not for you to have to release any of the bracelets, but just to watch this. Again, do your limb integrity assessment, looking for hematoma or anything like that. If this were to bleed, all you would have to do is take the syringe off, and you can see by moving it around, you can allow to fill up to 20 mils. So you would pull down and add between 2 and 5 mils of air to this compression device. And that would apply your direct pressure for you. If you were not comfortable with that, this comes off via Velcro, and you would do a direct application of pressure. So these are the 3 different bands that we have in the New Brunswick Heart Center. This one is maybe the most, the newest one, and may cause some concern. But see what happens when I don't have this little button in proper position is all of a sudden all of this air come out of the compression device. So again, it can be manipulated so that only 2 mils of air come out at a time. So again, if you have any questions with regard to bracelets, they're very simplistic compression devices. And normally our protocol, if the patient were staying at the New Brunswick Heart Center, would be to start releasing that bracelet 2 hours after the procedure. So if that happened to be the time maybe halfway through an ambulance transport, then I would just leave the compression device on until you offer report to the receiving hospital, and the registered nurse can deal with releasing the band. Only concern that Ambulance New Brunswick should have about the bracelets is if it were to become loose and the patient were to bleed. So you can reapply them, no problem, but you can certainly apply direct pressure. What we do if we don't have a compression device is we apply direct pressure for a minimum of 20 minutes, and then we assess for hematoma development. So bleeding out or bleeding in, as you know, is equally as important. So doing a good assessment of the insertion site. And if you have any issues, you can certainly call the nursing department that has sent the patient on transfer, and they should be able to answer any of your questions with regard to the devices. So I thank you for your time, and once again, please know that the success of the New Brunswick Heart Center is really centers around you, ladies and gentlemen. So we thank you for your help, and enjoy your education sessions. Have a great day. Bye-bye.